What are some common differences, if any, in AML between men and women?
There are no real biological differences between men and women as such. There is some data that was just recently looked at, not in AML, but in myelodysplastic syndrome, which is like considered like a precursor or a risk factor for conversion to leukemia. There may be some differences in how women respond to a particular drug versus not. There's a whole category of drugs called hypomethylating agents, which are commonly used in myelodysplastic syndrome, and in leukemia patients, it's used in older patients who cannot tolerate chemotherapy. There's some evidence that maybe women have a slightly different response in terms of the ability to respond to the drug, one versus the other. There's two kinds of hypomethylating agents, and maybe one's better than the other, and we don't understand why that observation was made. But in general, there is no major biological difference. Obviously, treatment challenges are different, particularly in younger patients who are male versus female, because we think about fertility issues that affect both sexes differently, and the effect of chemotherapy is different when you talk about its ability to affect men versus females with AML. So there are some differences there, but overall not a major biological difference between leukemia in men versus women.